My name is Leah Geyer. I work in the downtown general internal medicine clinic at Virginia Mason, and I'm a general internist. So general internal medicine, what we do is we take care of adults, so we take care of men and women, and people ranging from ages usually 18 all the way up into 90, 100. We take care of a pretty wide variety of medical conditions, so we have some patients who are really healthy, and mostly we work with them on keeping them healthy, so we do a lot of blood pressure screening, we take care of vaccines, we do cancer screenings. For women, we do a lot of gynecologic care, and then we also manage pretty complex diseases. So some patients who have things like heart failure, diabetes, or COPD, sometimes all of them combined, we have a lot of expertise in managing that. We also manage uncomplicated psychiatric conditions, so anxiety and depression are pretty common parts of our practice. So when I'm first meeting a new patient, we usually start off by putting their medical issues aside temporarily, not for very long, but because I find it's so helpful to spend a little bit of time talking to someone and finding out who they are, what they like to do, what sort of family they have around, and sort of trying to get a window into how they view the world, because it really helps me as time goes on to be able to know that in terms of helping to support them and making good decisions for their medical care. So that's how I usually start off. From a patient perspective, I think that it really raises the quality of care for patients whenever they're getting to work with a doctor who also works with trainees. And I think it's a couple of reasons that that's true. One of them is that when you're working with trainees, you really have to stay on top of the medical literature, and you have to be up to date, and you have to be able to explain why you're doing something. And so it just keeps you really on your toes and with a good handle on what kind of the latest medical knowledge is. And then I think the other really cool part as a patient when you're working with, when your provider also has residents or medical students, is that it's a way that you get kind of a window into how we're thinking about clinical problems. Because often we'll be explaining in front of a patient, this is why we should do this is why I want to do this test, this is why I think this is what's going on. So it sort of pulls back the veil and allows for some transparency in a way that it's hard to manufacture otherwise. So I think I love teaching, but I also I think it makes me a much better doctor. So when I'm not working, I spend a lot of time volunteering in my daughter's classroom at school. When we're not doing that sort of thing, my family spends a lot of time in the mountains, so we ski, we backcountry ski, we rock climb. I also do a lot of yoga. I run a fair bit, and I like reading. A huge part of the reason for me that I chose Virginia Mason is I think it's a neat organization in that it kind of mixes the best parts about a really big medical center, meaning that we have a lot of teaching, we do research, we have really excellent clinicians, but then also it's a small enough system that patients get a lot of individualized care. So I think it's a really lovely place to work because I feel like my patients get really good care, and I feel like I can trust the medical system if I send referrals or I send people to go work with other physicians, I know that they're going to get high quality care and it's not going to be super stressful for them most of the time.